JL. As you may know, the reading group happens on a monthly basis. And we are happy this month to welcome John Blevins from Emory, Rollins School of Public Health at Emory, to present on his new paper, a working paper, COVID-19 and the Politics of Life and Death. As usual, the session today is being recorded and we'll put it online after we finish. Just to note, if you don't want to be recorded, that you can put comments in the chat or send a message to me in the chat for any questions. So I think that's everything for now. I will hand directly over to John to tell us a bit more about his paper. John, over to you.
Thank you, Olivia, and thank you for the invitation to present a paper that's a work in progress. It's a long paper, longer than I hope it will be in its final iteration, but it's so long in terms of the various elements within it that I thought it would be helpful to summarize those elements before we get started in a discussion together. So what I'm trying to do in this paper is to examine the ways in which my own field, that field being public health, disavows a sense of its own biases and its own priorities and particularities in the work, both in regard to research and also in regard to public health practice that it carries out. It disavows that by claiming to present and to carry out research that is objective, both objective in terms of the question being asked and objective in terms of the research, study, and design and the interpretation of data. And there are all kinds of structures within public health research frameworks, and I work within the area of qualitative study, that are designed to reinforce this idea of objectivity. There are processes for consensus building around articulation and interpretation of narrative data. But I would argue that behind all of that, and one step removed from all of that at a deeper level, there is an interpretive framework that's at play. I don't necessarily think that is a problem, except to the extent that we do not acknowledge it, and we don't reflect on the ways in which that background prioritization of articulating and framing health from how public health understands it and make sense of the phenomenon of health, that by assuming that's a universal that everyone shares, we can be violent in terms of trying to impose that perspective and those priorities in the work that we do in regard to what really matters when we put our work down on the ground. And to lay that out, I wanted to look at a study that I'm helping to carry out in 7 different countries on perceptions of COVID at the community level, to just summarize the religious topics within that data as the first part of the paper, and then to raise this kind of conceptual framework that describes the potential dangers of a certain way of conducting public health research, of public health as a field, using the ideas from a French cultural theorist named Michel Foucault, and Foucault's idea of power, and how that connects to more recent work by a Cameroonian cultural theorist named Akile Mbembe. And so I look at and develop and describe 2 theories, that of biopolitics from Foucault, a politics of life, and necropolitics, a politics of death, from Mbembe. And then with that conceptual framework in mind, I return to the study on COVID perceptions to see if looking at that data from the framework of biopolitics and necropolitics playing out, new things might come to the surface, and new priorities in terms of what the data is showing us may come to the surface. And so that's the three kind of stages of the paper as I developed it. Let me briefly tell you about the study itself, and let me briefly walk you through those three stages. So this study that I reference in the paper is a qualitative study that is being carried out by a public health mortality surveillance project called CHAMPS, which stands for Child Health and Mortality Prevention Surveillance. This is a very large multi-country, multi-year longitudinal study to identify the causes of death in children under the age of 5 in areas of the world that have annual mortality incidents of at least 50 deaths of children for every 1,000 live births. Just for reference, the mortality rate, under 5 mortality rate in the US is about 8 per 1,000. The global average is about 37 per 1,000. And the average across the study countries where CHAMPS is operating is about 90 per 1,000. So they're all areas with very high rates of under 5 mortality, both among stillbirths, neonates, and then pediatric deaths. And the program exists to identify what those causes are so that more effective public health programs and interventions and structures can be created, and existing structures improved to improve health outcomes. When COVID, and I coordinate social behavioral sciences across the network. We're active in 7 countries, in Bangladesh, Ethiopia, Kenya, Mozambique, Mali, Sierra Leone, and South Africa. We're launching in India, and in 2023, we will launch in a 3rd country, either in South Asia or in Sub-Saharan Africa, bringing us to a total of at least 9 countries at that point. The perception study was developed because of a recognition of the impact of COVID in the community on health in general, and also how it was impacting the implementation of the surveillance activities themselves. And so the Gates Foundation, which is the funder for this project, was really interested in understanding what were people on the ground in local communities in this kind of cross-section of countries around the world, how were they perceiving COVID? So we developed a study design for semi-structured interviews with key informants, or if it was feasible in the midst of COVID numbers, focus group discussions, if they could be carried out outside with social distancing and masking in place, to identify community perceptions along 5 topic domains: general perceptions, perceptions related to risk and prevention activities, perceptions about who is to blame for COVID and the relationship between blame and stigma, and then perceptions about various kind of psychosocial impacts, impact on economic livelihood, impact on food security or insecurity. 135 participants were interviewed across the 7 country sites. And as the sites analyzed that data, and they analyzed the data using a framework analysis because of technological limitations on conducting a thematic analysis with coding software. As we developed that framework analysis, when we aggregated all of that data together, there were 1,939 different responses from participants as to perceptions of COVID. I didn't summarize in the paper all of that body of data, but I just flagged those responses after all of that data was coded around responses that referenced religion in any way, and 86 responses referenced religion. And we created, we organized those coded religion responses along 4 themes: religious beliefs, the characteristics of believers in relation to COVID or in relation to their faith and religious practice in response to COVID, the nature of God, the relationship between religious practices and COVID, and the public health impact. We identified 3 sub-themes in relation to beliefs. There were some description of a kind of apocalyptic description that COVID represented the final judgment of human beings by God and was a harbinger of God's final judgment. There was a description on the ways in which COVID and restrictions for travel had impacted faith and faith practices, and those who were not strong in their faith were falling away. And there was an articulation from a few participants that there were religious beliefs that simply made no sense to them from their perspective. Those were related to the idea that COVID was a punishment from God. They didn't see God in that way. And also a sense that religious beliefs represented a kind of final judgment of God. They just didn't understand God acting in that way. In regard to the characteristics of believers, there were a number of responses that articulated turning to God and placing ultimate faith in God in relation to the outbreak. The idea that people were God's instruments, particularly healthcare workers, a sense of thanksgiving that people had not become infected, and in a few instances, a sense of thanksgiving to God in all things, whether people were infected or not infected, and a belief that the only safe place to place one's hope was in God. There were descriptions of the nature of God, God as healer, God as being the one who was in control, and God as punisher, that God was punishing human beings, either those who were infected as individuals, entire nations or societies for their corporate sin, or all humanity in terms of a kind of final judgment, with COVID representing all of those things among some participants. Then there was a description of the impact of COVID on practices, how COVID had impacted and changed processes for corporate religious expression and activities, had led to cancellation of corporate gatherings or modification to those gatherings, how COVID had changed both how prayer itself was carried out and what people were praying for, and the relationship between prevention efforts and corporate religious services. And then in regard to the public health impact, there was a few, but not many, descriptions of what JLI is often interested in, of the contributions of faith-based organizations to support a public health response, with one person who was responsible for community outreach in Sierra Leone, describing the distinctive and substantive contributions of faith-based partners. Faith-based organizations. So that's a summary of the religion data. I want to briefly turn now, and it's a bit of topic change, to the conceptual framework that I put in place before I return back to that data with that conceptual framework. This is theoretical, so I'm happy to answer questions to make sure everybody understands the concepts that I'm about to lay out here. So I developed a conceptual framework based on Michel Foucault's description of power. Foucault wasn't so much interested in the ways in which a misuse of power through repression created negative consequences and impacts on modern societies. He acknowledged that that happened, but his real interest was on how expressions of power that he called productive also carried a negative consequence or impact. And he described productive power as the kind of power that Western civilization, Western societies and governments and liberal democracies operate under as their kind of default mechanism. It's a power that calls us, everybody who's under its effects, calls people to agree to follow its demands, the demands of power, in order to receive a benefit, in order to receive the benefit of what it produces at a social level. He describes the ways in which social economic initiatives and programs, educational initiatives, health initiatives function with this kind of idea of, if you'll agree to follow these kind of things, you'll get a benefit. As an individual, you might get a benefit of more education or better health or economic opportunities. As a society, if we implement these things at a social level, will lead to the betterment of populations of our nation, of other nations. In terms of development aid and development structure or public health and global health programs and interventions, the idea that we had an obligation to carry out such programs for the betterment of other people who were less fortunate than us. Foucault argued that to say yes to that kind of power, either in your own life or in agreeing to implement them at a structural level in the society or in another nation or society, always carried a price, because the benefits that were bestowed on us as individuals who said yes to these structures were always paid by people who were deemed unworthy. They were either unwilling to agree, and so they were identified as an outlier, abnormal, a criminal. They were suspect in some kind of ways, or they were deemed as not kind of rising to be a target or a subject of these kind of practices, and they were left to die, or they were left to their own devices, and they paid the price in terms of inequitable distribution of resources being played out. In a book called The First Volume of the History of Sexuality, Foucault says that power functions in the modern era to make, live, or to let die. And what he means by this is the productive element of power is to incite us and entice us to agree more and more and more to engage in the practices to make, live, to live better, to live healthier, to live better economic lives. But that there are people who are simply overlooked in those processes, and they're allowed to let die. They're not actively sought out for punishment or for death, but they are allowed simply to kind of wallow in low levels of health, in low levels of education, and low levels of economic development. And that happens in the nations of Europe, the nations of North America, and it happens globally in nations where interventions are being carried out. And he argues that that is the dynamic of when we all agree to this kind of getting on the treadmill of making life better and better and better, some people are simply left off that process and their lives are actually worse. We see that in colonialism and in the structures of colonizing rule, and we see it in post-colonial context through the structures of economics and through the structures of government intervention that have this kind of priority of the interest of the nation from the global north and North America at the detriment to the priorities of countries where those activities are being carried out. And so Foucault's critique, if you buy it, if there's something to it for you, speaks directly to the work of international development and health initiatives, which are obviously front and center for JLI. He described that process, or he named that process as biopolitics, the politics of life, which always carry with it the politics or the creation of structures that actually contribute to death. But he always interrogated this dynamic between these functions of power on the side of European structures, often French structures. And so we always interrogate it from the side of biopolitics. That was back in the 1980s. In 2019, just a few years ago, Akile Mbembe, who's a philosopher from Cameroon, who now works often in South Africa, also works in the United States, drew on Foucault's ideas and responded to a criticism of Foucault that many had raised, that he only focused on North American kind of cultural analysis to describe the other side of that dialectic, that if Foucault described what biopolitics looked like, Mbembe was going to describe what it is like to live within a nation and a society that has been deemed to be expendable and can be allowed to let die. And he described the politics of death, or necropolitics. He wrote a book by that title that was published in 2019. And for Mbembe, he actually argues that this dialectic that Foucault described between the politics of life and the politics of death is coming to an end, that the alliance that had been created at a macroeconomic level between global capitalist structures and government structures after the Second World War to allow for the rebuilding of Europe and to allow the United States and Western European nations to carry out the Cold War in response to Russia and Russia's satellite nations. That played out in the Cold War through a variety of health and development initiatives, often on the continent of Africa. And as with the fall of the Soviet system, that was no longer necessary, and the redevelopment of Europe had taken place. And global capitalism no longer needs the structures of government to carry out these kinds of activities to prop up and to support capitalism. And he argues now that capitalism and capitalist impulses hold sway in structural systems today. He says that there was a time when biopolitics required that you not explicitly name the kind of animosity you might feel, or kind of throwing off the idea that you're going to care for, that you're going to allow entire societies or portions of societies to let die, to be ignored. That with biopolitics kind of waning, we see this rising rhetoric, and we see this rising kind of articulation in government and civil society that there are really people who are dangerous, who aren't worth caring about, who are suspect either for what they'll bring into our country or for the danger that they might pose to us. And this kind of rising rhetoric about the danger of the other, and this heightened policing of borders, both national borders in the United States, the building of a border wall and the debate we had in our country about that, but also policing ourselves within our country to feel more secure, because everybody's dangerous and everybody's different from me, and all these other people who aren't like me, I've got to watch out for. And Mbembe argues that this kind of structure is spreading out across nations, certainly spreading out among the former colonial powers in a way that the nations in lower and middle income countries are paying just a tremendous cost for this kind of structure of power. And he argues that necropolitics, this politics of death, is front and center right now. He's not at all an optimist, as you might imagine from what I've just described. I want to read to you a short quote from Mbembe about what it means for necropolitics to be operative right now. Quote, "The end of the world has already occurred. The question is no longer how to live life while awaiting the end of the world. Instead, it is to know how living will be possible the day after the end. That is to say, how to live with loss, with separation. How can our world be recreated in the wake of the world's destruction?" So Mbembe is arguing that we're shifting through an era of kind of Western liberal democracies providing a kind of universal default structure by which the world operated, and that system's fading away. And at least for right now, that world as we've known it is coming to an end, and there's tremendous vulnerability and danger for countries in lower and middle income settings to just be written off, and the health consequences and impact to be catastrophic. So why biopolitics and necropolitics is a framework for what I want to talk about. I was reading necropolitics with a PhD student at Emory in an independent study with that student. She's a PhD student in theological studies here at Emory when the pandemic hit. And I kept thinking to myself, this feels like a real-time example of this dynamic that's playing out that Foucault first described and Mbembe is pointing us to, with biopolitics kind of not working anymore. If biopolitics at a structural level function to tell those of us from places like the United States that we were insulated from poor health outcomes or poor economic outcomes or poor educational outcomes, and by saying yes to the structures of productive power, then when it starts to unfurl and it no longer functions in that way, we'll see that bargain no longer having the payoff that it had made for us, that it had offered us, what it enticed us to in the first place. And I wondered if COVID was an example of we're actually in a high level of vulnerability for COVID, and all of these structures of insulation and protection aren't doing anything to stop this virus from crossing borders and to creating the potential risk for us all. And then I began to hear, as I talked with our social behavioral science teams and the CHAMPS network on the ground, that there was a general perception, particularly a year ago, that COVID really wasn't such a big deal. In the first place, malaria was worse, and there were other health conditions, other disease that were far more dangerous in terms of both illness and death, and a general perception that Europe and North America are freaking out about this thing, but it doesn't really affect us. And that became this kind of idea that it only affects white people and Europeans and North Americans at high rates. Black people, brown people are not really vulnerable to COVID infection. That wasn't borne out by the epi data. That was a perception that was in the air. So with this idea that necropolitics, that COVID might demonstrate a kind of case study for looking for necropolitics, I went back to the data from that study, and there are a couple of things that jumped out for me. First, this study was conducted to identify health outcomes for the public health impact on COVID for health services and health outcomes, and to identify the public health response to improve it in regard to COVID. But at a much, much higher rate, participants told us that the greatest impact on COVID had been its increase in contributing to economic uncertainty, and how the public health response had also contributed to that economic uncertainty. 94% of the respondents who we spoke with specifically identified the economic impact of COVID in a variety of ways. 97% of the respondents in the study identified the impact of COVID on food insecurity, and that COVID had created, in some instances, quite dire and emergency conditions for food insecurity and lack of food availability. In contrast, the thing that public health was interested in, the impact of COVID on health services, that was named as having an impact at 80%, that COVID had impacted in a negative way, being able to access health services among 80% of participants. But COVID itself, while it was seen as a cause for concern by a majority of respondents, it was far lower than the other causes of concern. COVID was a cause for concern among 66% of the respondents, whereas food insecurity was 97% and economic insecurity was 94%. And 20% of our respondents said that COVID was not a cause of concern for them at all. Some of our recipients described the political systems that had generated the public health response, and they described that the effects of that system was ambivalent. One, that it had created these kind of secondary negative impacts in trying to mitigate the effects of COVID. But there were more pernicious descriptions. A couple of people described their perception or the the idea that they had heard that COVID was a bioweapon that had been developed either by the United States or by China and had gotten out of control. One participant in Sierra Leone described in a very nuanced way that nations like the United States, China, Italy, and Japan profess to help us. They say they want to come in and help us. They said they wanted to help us in response to Ebola, but they're actually the ones who make things worse for us because they bring things like Ebola and they bring things like COVID to our communities. They actually referenced a longstanding parable within their cultural context, speaking about a road that brings fire to the community and destroys the community when that road was professed to be the thing that would help people out. Some participants blamed foreigners and even citizens of their own country who traveled inside the country. And epidemiologically, we know that's true. They were vectors for transmission. But I wondered, in light of necropolitics, whether this was an example of this kind of idea of policing borders and a suspicion of strangers and outsiders. And then in the midst of all of this, where I began to look for necropolitics at play, I began to look also for how religion functioned in relation to this. One participant in Mali said that COVID was because we had given up the old ways that had been around for untold centuries, and he called for a return to old ways. I interpreted this in light of the idea of this kind of outsider imposition of structures that we tell people are going to make their lives better, and he's actually arguing that we've made our lives worse. That nostalgic return is not actually possible, and I think most people would acknowledge that, but he named it. I looked at the ways in which some religious leaders, particularly an assistant to an imam in Bangladesh, were placed into these tensions that they simply couldn't resolve. They wanted to follow the public health guidance. They were communicating that guidance. They were encouraging prevention efforts and initiatives such as masking and social distancing. But people in their local communities were insisting on attending corporate worship and corporate prayer and not following those guidelines. And politicians were also encouraging ignoring those protocols and principles. And what's this religious leader to do between these kind of irresolvable tensions? In regard to religious beliefs and articulations, I noted how there was some people gave thanks that the virus had not been visited upon their community and interpret that as an implicit way to reinforce this kind of fear of the outsider and to use a kind of religious structure and religious rhetoric to reinforce borders. But there were also other ways that religion functioned over and against necropolitics. There was a refusal to blame anyone and a kind of sense among some participants of God's sovereignty, and that God was a good God who would help to bring us through this challenge. There was one mother in Sierra Leone who felt this tension between carrying out a public health response that she was responsible for helping to integrate or implement in her community, and knowing that doing so, she might bring the virus back into her home and she might expose her own children, or that her children would be exposed as they had to spend the day with extended family members. And this obligation she felt to care for her community was creating a vulnerability for her and for her extended family network. And she asked this question in her interview of, surely God will forgive. God will forgive her for potentially exposing her family to the virus. God would forgive her children because children can't follow social distancing and masking protocols. And surely God will not be so demanding to require that the innocent pay that price. And then finally, the most searching narrative for me came from a mother who had been infected with COVID and who had recovered, who says that no one is to blame, but if anyone is to blame, the only one she will blame is God. And she's not angry at God, but she's saying in that context that God, if God is God and God has power, God will has to account for both the suffering and the death of COVID, as well as to be praised for bringing people through. She noted that while she was infected with COVID, others in her household, including her grandmother, with whom she slept in the same room, and her children who slept in her very bed, were not infected. She said that God was responsible for protecting them. But in raising this kind of theological framework of God's sovereignty in the midst of life and death, she's calling for God to account for both of those and not letting God off the hook in regard to either. I wonder what that might say in regard to this idea of biopolitics and necropolitics as Mbembe raised it and framed it out. And that's where I end the paper. Thank you. I'll turn it over now to Katherine for response, or to Olivia.
Yeah, no, just thank you very much, John. I'll turn it directly over to Katherine for the response. Katherine, I'll just unmute you. Let me get this up.
Sorry, I had to unmute as usual. I found myself with far more questions than observations, and almost sort of internal yes buts to everything. First of all, the paper is obviously a fascinating one, where I think you're asking or probing, at least exploring, a whole set of vital questions that are both very broad, sort of what's happening to the world, but also very specific to the COVID response. And I found it difficult to navigate among them, and want to put questions back to you. I mean, you started with really two essential challenges. One that I think comes a bit under the heading of unconscious bias that all of us are looking at now. In other words, we think we're being neutral. We think we're taking into account all kinds of different disciplines and influences and geographies, particularly those of us who work globally. And yet there is a real possibility that we're nowhere near as neutral as we say we are, or that we think we are. And my question to you is, after doing this examination of biopolitics and necropolitics and hearing some of the direct testimony, was there anything you thought you'd missed? I confess that none of it, in some sense, surprised me. It's obviously a relatively small sample, each one embedded in the full complexity of the local community. But did you find that there were any surprises in terms of things that you would not have expected, that were not things you hadn't heard? So that is the sort of unconscious bias problem. And I'll come back on that in a second. And then the second is the way power functions, and the complexities and the greed and the psychology and the interests that are involved in the way any community works, but frankly, all the way from a family deciding how to allocate their budget to the United Nations. At every stage, you've got the politics that's affecting the way decisions are made, that has a whole bundle of different things. I think where I found myself with most of the what's is in the link between the huge scope of the Foucault-Mbembe questions about sort of the legacies of colonialism and the way that seeps into public health approaches and psychology. And I found the chains a bit hard to connect for both of them, the sort of end of the world philosophy, but also the ways in which the sort of post-Cold War politics has sort of changed the way that the development profession looks looks at things. I also found myself wondering how some of these issues of responding to disease and pandemics look when we look at it chronologically. That, you know, my great-grandparents had 14 children, many of whom died. I mean, that was the nature of life, even in, quote, developed communities in some ways, in the same way that they might play out now in a village in Sierra Leone, or in you know, an urban community where you have high mortality, which is sort of the CHAMP study, is looking at these questions of mortality. So how would we look at the way our ancestors dealt with child death and the questions that they asked about, you know, why did this happen? How does this relate to God's power? How does this relate to what I'm told in the weekly sermon or in the funeral? And obviously each community, each person, I think, probably would answer those questions differently, but trying to take those questions and then turn them into this geopolitics and biopolitics and necropolitics takes you along quite a chain that I think is difficult. And what I'm most interested in is what you found in this. What did you think? What did you decide? And the other thing that I think you alluded to in several of the discussions or some of the interviews is this question of responsibility. What does this do to our responsibility? What are we supposed to do about this? Yes, listen more, be more sensitive, be more aware of who's being left behind. What do we do about the no one shall be left behind mantra? That is what we're all talking about. Yeah, and then the final thing that, again, I mean, we've known this issue of food versus COVID has been there from March 2020, and it's dramatic in South Africa. It's politically debated. So what's the surprise? What is there that we didn't know? Does it speak to the public health profession saying that they just don't get it? They're too authoritarian, too top down as a profession, which means, you know, that's the way people are being taught in school, or that's the people who are attracted to public health as people who have the authority to say, this is the message and I don't want to hear anything that contradicts it? Or is it sort of one of those contradictions that's sort of intrinsic in life, which I guess is sort of the extreme of it all? So that's a few questions for you without much wisdom to add.
Lots of questions posed, and actually, I am going to just say there. We will want to hear from the rest of the group as well for any questions that you have. John, I will give you just 5 minutes to respond to Katherine now, but just to give notice to the rest of the people in the room, if you have any questions, please start thinking of them or typing them in the chat or putting your hand up so I that you have questions. But John, back to you now.
Thanks, Katherine, for your questions and for your engagement with the ideas. Really quickly, let me say that the study itself and the data that I presented really didn't present any complete out of left field responses that led to insights that I hadn't already had a number of discussions with colleagues working in the public health field, either in faith-based organizations or in public health structures related to COVID. But it reinforced those. You and I were on some calls early on in the response that the guidance, for example, for household control, if someone in the household is suspected of COVID, that the WHO, using CDC structures, put out just did not work for most people living in the world who live in extended family networks in 2 or 3 room households where there's not a separate bedroom and a second or third bathroom to completely isolate within. And what do you do about that? And, you know, initially early on, we thought this might be an outbreak that would peak and wane in a period of a few weeks or months. And we even developed some structures that are still up on our website for isolating in a household or creating households, household networks in regard to that. Completely unrealistic, but the public health information was also unrealistic. And what I found was these kinds of instances again and again and again, and talking to people working on the ground of public health is asking particularly valid things about this epidemic and pandemic, and they can model what exponential disease growth could look like and the absolute essentiality of flattening the curve. The processes they're telling us to do that are going to have a real impact on food security, economic insecurity, all of the things that people were telling us a year ago. And the prevention mechanisms really aren't feasible for implementation. So people are caught in this rock and a hard place kind of response. What I wanted to do with this paper, when that was happening for me, I read Foucault and have used Foucault in my own work for a long time. And I kept thinking to myself, this is an example of what he's talking about in regard to power. And I was reading Necropolitics at the time and was saying, and here's in real life, what's happening now is that thing of the structures of biopower and biopolitics breaking down. Foucault didn't say that there was no good to be gained from the structures of productive power. He certainly wouldn't say that better health outcomes or better, more economic resources or increased education outcomes are a bad thing. He wouldn't say that at all. What he was saying is that for those of us in cultural contexts such as North America and Europe, who see these as kind of unmitigated successes, there are always these things that will change the game and will lead to the eradication of all the indicators in the Sustainable Development Goals. He's far more pessimistic that that would actually happen, that there will always be consequences of a misuse of power by implementing these kinds of things that are carried out with the idea that you're doing something for someone else's own good. And that's what I'm really interested in. I think there are a lot of slippages. It's very conceptual. There are links in the breaks in the signifying chain between biopolitics, necropolitics, and the complexity of things on the ground. But for me, at least, those ideas lead me to be asking the question that I don't think public health does very well. What are the consequences of the things that we do that we think are for the own good and the better health outcomes of a community that have a negative effect? And we need to be honest about that. We look at that only in public health by looking for unintended consequences after we've done our work. But in fact, there's a lot of ways that we need to be asking questions as to whose interest, whose priorities, who funds, what does their funding look like to structure what we ask and what we don't ask in terms of priorities, and that we need to articulate and take account of the culture of public health when we go into another culture and not assume that we're neutral or objective as we do that.
Thanks, John. Okay, I'm going to pass over. iCandy, do you want to say something? I see your notes in the chat. It would be interesting to hear about your perspective of how different religious religious forces are both supporting and having to reject anti-COVID stances from politicians.
Thank you, Oliver. I just had a very general observation. Tanzania wasn't the case, one of the countries that were studied in the paper, but I think it could generate very interesting observation given that there was denial of COVID-19 in the country. under the former administration of President Magufuli. But then there was a mixed reaction from from different religious groups. For example, when it comes to churches, the Pentecostal kind of churches, those that are individually owned, they actually supported him and said he's a prophet from God, he's bringing confidence. And Magufuli used a lot of religious rhetoric to actually push for his stance. But then there was these other churches, especially the mainstream one, the Lutheran Church, the Catholic Church, that actually went against his stand. But he actually used even the church podium, for example, the Catholic Church, because he was a Catholic, to defend his position, why people who are afraid of COVID, they don't have faith. So anyway, those are just interesting observations, but it has created a lot of mixed reaction from the community, from the citizens. The effect that we still see now, even with the change policy, whereby the government is promoting vaccination and it's promoting vaccination and all these healthy measures is prescribed by the WHO and Health Ministry. But it's still very complicated as to how the community and the large, still a lot of people believe that COVID-19 is not a threat or something that is external. And it's just interesting how how can I say, how the state can actually influence people thinking. And Katherine was talking about necropolitics. And I think this is exactly how we can see an example of it, whereby one person can determine how people should live or die, because even the health structure was very much affected, whereby the doctors could not say anybody has COVID-19. Even treatment of COVID-19 was almost a crime. So it's just an interesting case. And when I was reading this paper and in this presentation, it just gave me a lot of reflection that I think probably there's a need for more research of how different states reacted and how religion played a role. And there's one article that actually is just it's a news article kind of, but extended one, whereby this author explained how the church, in particular the mainstream church, actually forced Magufuli to almost accept that COVID-19 has come to Tanzania, but we didn't know where he was going about because he died before he could explicitly acknowledge that there's COVID-19. But thank you so much. And I look forward to learning more and to read more about religion and COVID-19 in different countries.
Thank you, Aikandi. And now we have a hand up from Mohammed as well, and then John can respond.
Hello, everybody. Hello, John. Thank you very much for this interesting and eye-opening talk. Actually, me as a doctor, actually, always we think that we are like a sacred profession, actually. But now you said that we are under this dynamic of politics. So we need to rethink our profession. I have two observations, actually. I'm not sure if it is related to faith, but I may take your opinion about that. I work in an area in Syria, in northwest Syria, when in the areas that are out of the control of the regime, we call it liberated areas. And there was a lot of hesitancy in dealing with COVID and taking vaccination. And interestingly, the COVID was delayed till 3 months after Turkey in the border has started COVID cases to enter into north of Syria. But it was not a very big problem, actually. For some reasons, there was no much cases, actually, right? However, recently, like 2 months ago, when Delta variant came, unfortunately, now we had all the hospitals are filled and the health system about to fail. Now, I had two observations, actually. One is, I call it the lying shivered story. I don't know if I'm pronouncing it correctly. So when a shepherd says that a wolf there and he is lying then people come to help him, and right, once and twice, and then the third time, when a real wolf comes, nobody will believe him, right? I felt like this is the same with WHO, with INGO, with politics. When they fail to respond to corruption complaints, for example, to correct their work, when the real problem comes, the people didn't believe about all these procedures that they are trying to impose. So I don't know if you have any thought about this. The second thing is, one of the reasons why people are hesitant and reluctant to take vaccination, they said, look at these developed countries. They do demonstrations against vaccination. Why you want us to take this vaccination? So also, I don't think it is related to this, like, even power, like, you know, this idea that they take a demonstration, we need to take demonstration also. So this is two observations from my context. Thank you very much.
Thank you, Mohammed. John, this is a wrapping up moment, so.
Okay, let me quickly respond to Mohammed in regard to COVID and Delta 19. That doesn't surprise me. This is a longitudinal study, so we actually have second wave of data that we're not done analyzing, so I didn't include it. And perceptions about risk and vulnerability changed. To be clear, I'm not saying that there was no risk in relation to COVID. I'm saying that there was a perception of level of risk that wasn't based on epi data and incidence rates. It was based on how people were making sense of what they were hearing and experiencing on the ground. And that's how human beings work. And that reveals something about what they're bringing to the context to look at that. I think you're right that international NGOs, including faith-based organizations, sometimes face suspicion and skepticism about what we profess to be doing. And yes, corruption is one of the things and has to be addressed. I actually would wonder if in many instances it's more complicated than that. And it's not about our failure to address corruption, because I think in many instances NGOs actually speak out about corruption or have structures in place to address corruption. It's that we come in with the idea of, here's what you need to do, and we're telling you to do this because we really care about you, and this is for your own good. And we're not listening to local communities. And in that way, I think that the thing for at least my own field of public health to interrogate is how that motivation of compassion, or that motivation of making, wanting to make things better, can also get caught up in structures of power where people on the ground will experience it very differently than how we are experiencing our own motivations. And that's what we need to be interrogating as we go in to do our work, and that we don't do it very often.
Thank you, everyone. We are over the end of the hour, so I will just wrap up here. But as a reminder, this will be on, this recording will be online, and we will have John's paper has been circulated to everyone beforehand. So thank you, John and Katherine. John, it's great to have the biopolitics and necropolitics brought into our religions and development debates. I think this, well, I've said before, I think COVID-19 is something that we're all going to be studying for the rest of our lives, potentially. So we have a long time to think about this, and this is just the very beginning. But the idea that, yes, religious influences play into the creation of the biopolitics and necropolitics, and religious justifications help people justify their existence within the necropolitics of our time, is absolutely fascinating, and I think something that we can take as, take this theoretical framework and apply to a lot of our other areas of research and study too. So thank you.
And real quick, and that cultural systems, including religion, can help us to narrate and think of practices to counter it, not to dismantle it, but to not have to play according to its demands and dictates. So religion can also be a way to push back against those kinds of demands.
Absolutely. Yes, absolutely. Okay, so we'll leave with the potential power of religion to push back against the necropolitics of our time. So on that note, thank you everyone for participating. Again, we'll be have another session in a month from now, and so I hope to see you all then. Thank you very much, everyone.
Thank
Bye.
you all. Thank you, Katherine, for your response.